The modified Lapidus arthrodesis serves for correction of large intermetatarsal angles in cases of hallux valgus and severe forefoot supination malpositioning. While the fixation is described in the original work by Paul Lapidus in 1934 with periost sutras, today modern osteosynthesis systems are used. Screw osteosynthesis, in combination with wires or bone staples running dorsally, became commonplace in the 90s. This led to improved healing time. However, the patients had to refrain from putting pressure on the joint for 8 weeks, which was unsuitable for many patients. With the development of the angle-stable step plate for the dorsal approach, the problem of measurable plantar displacement was solved, but the patient still had to refrain from loading the joint. The Totalfix System 2.7 is well suited for osteosynthesis in cases of Lapidus arthrodesis. It is a locking plate system with high fixation force on a small area. It offers an anatomic fitting form with allowance for the positioning of the tibialis anterior tendon in combination with a 2.7 screw system with locking and standard screws. Mini-can 3.5 cannulated compression screws serve for the additional stabilization of the compression of the arthrodesis. Central arrow cavities on the plates permit appropriate positioning of the plate on the arthrodesis without the need of intraoperative X-ray monitoring. The implantation of a locking Totalfix plate in the medio-plantar direction has a decisive advantage. Aside from the fact that the surgeon can become convinced of a closed arthrodesis even on the plantar side, fixation is performed in a biomechanically rational manner with a tension banding effect. That is, if the patient applies partial load after the operation, he compresses the arthrodesis and improves the bone building process. Before the plate is implanted, compression on the arthrodesis surfaces is achieved by a Mini-can 3.5 cannulated compression screw that is introduced from the extensor side of the first metatarsal base into the medio-plantar os cuneiforme mediale. This extremely stable fixation permits an early partial loading in the therapy shoe and significantly aids the secondary treatment, even in elderly patients.